Welcome back to the Delaware Way, a potential huge medical breakthrough in Delaware. They are testing a blood test that could detect breast cancer. Here to talk more about that is Jennifer Sims-Mourtada, who is the director of the Breast Cancer Research Project at the Helen F. Graham Cancer Center at ChristianaCare. Thank you so much for being here.
Oh, thanks for having me.
So what exactly are you testing now?
So we noticed when we started mammography back in the 90s with the idea of early screening that we were finding a lot of cancers that really we wouldn't have found otherwise. They probably wouldn't actually grow into anything, would never become symptomatic, and would never have an effect on a woman's survival. But once we find them, we have to treat them. And so what this blood test does is give us a better tool, in addition to mammography, to know if these tumors are ever going to be invasive or leave the breast or cause a woman a problem.
Now, I understand that you're in clinical trials right now, so
yes.
This isn't available to everyone. It's early to get too excited about it, right?
Right.
But if it does become available to everyone, what kind of breakthrough is that?
I think this is a major breakthrough. We spend over $4 billion a year on overtreatment of breast cancer. It's been estimated with the additional biopsies and treatment that women go through. So this will be a huge health savings. It will be a savings to women. They won't have to undergo unnecessary procedures. And it will also give us a method, because it's a blood test, to follow women over time. So all the tests that are done right now on a lesion in the breast are done actually on that lesion. When it's surgically removed, you don't know what's going to happen next. So this will actually allow us to monitor a blood test, just like PSA for prostate cancer. A woman will be able to come back in the office every 6 months, every year, get the blood test, and know if anything's changed.
This breakthrough, did it originate in Delaware?
Yes. So this was a partnership between myself at ChristianaCare and a small startup company called GenPro, which was founded by Adam Marsh. He is a marine biologist at the University of Delaware. And he developed this algorithm through machine learning to be able to look at large sets of genes and really pick out interactions between small numbers of genes that can be prognostic of a certain condition.
You must be getting some national attention on this.
We hope so.
Are you?
We have just filed the provisional patent for it, so it's still very early on in the game. From the point now, we've just completed our first validation study, and we'll be moving on to national symposiums to present our data and hopefully be able to attract large pharma to be interested in helping us move this through the clinical pipeline.
I was just going to bring that up. That is the next step, right? Because
Mm-hmm.
once you get large pharma interested in it, that accelerates funding and testing.
Right, yes.
So explain to me how that would work.
So we would, Christiana owns the patent together with GenPro, so we would get a licensing agreement from a pharma company, and they would essentially take it from us and continue development, complete the large clinical trials, file for FDA approval, and then put it on the market so that it will be available to everyone.
How far are we away from that?
I would say, depending on financing, probably 3 to 5 years.
But so you're right at the genesis of this,
right.
At this point. Now, in 3 to 5 years, you said this is a major breakthrough. Bring it down to the grassroots level. What would this mean to women in America?
So you would go in, you would get a mammogram, you would get the blood test. If you saw something on the mammogram, if the blood test said that this is probably not going to be an invasive cancer, we would just monitor you. Right now, you would undergo a biopsy. About 25% of all lesions detected on mammograms are really not cancer. So women undergo biopsies, and they really don't need to. They just find out later that it was nothing. So this would save them from undergoing a biopsy. You'd come back 6 months later, and it would just continue to be monitored by a simple blood test until something changed in her gene profile where it looked like it was actually a cancer that's developing. And at that time, you would get treatment. So this would give women a way to really monitor their bodies and have more information and give physicians a tool to better treat patients.
This would be a major breakthrough. I mean, you've got to be so excited.
We are.
And just being a part of this, because how many times do you get to create something that possibly could be used all across the country and could save lives?
Yes.
And that's what we're talking about, right?
Right.
This will save lives.
This will save lives, and it will also provide a tool to, after a woman's undergone treatment, to monitor for cancer recurrence. So we can really start treatment really early on after a woman has a recurrence of breast cancer.
I don't want you to get too technical on this because I know you can and you might lose everybody, but what exactly are you looking for with the blood test?
So we're looking at how the body's own natural immune response responds to the cancer or the lesion, and we know that the immune response responds to cancer differently than it does other conditions, and so we can pick that out. And if we see evidence that your immune cells are responding to what is a tumor, we know that that's likely to be an invasive cancer, where if it's just some other kind of fibrosis or lesion, you won't have the same type of immune response.
So who was the first to spot this?
So this was a collaboration between myself and Dr. Adam Marsh.
Oh, and he was from the, is he from Christiana Care?
He's originally from the University of Delaware. He's now at a startup biotech company called Genome Profiling.
Wow, I know people that are researchers in cancer dream of these moments, so I hope this comes to fruition for you. It sounds like it will. Thank you for coming in and sharing it, and congratulations. Jennifer Sims-Mourtada, Director of the Breast Cancer Research Project at the Helen F. Graham Cancer Center at Christiana Care. When we come back, if you haven't been to the Museum of Natural History in Delaware, there is a good reason to go now. We'll talk about the events coming up, and the people at the Natural History Museum are bringing some special guests. You'll want to stick around for this when the Delaware Way continues.